This morning, new numbers show the measles virus spreading like wildfire. Texas, the center of the worst outbreak, now up to 223 cases, nearly double that from last month. In nearby New Mexico, 33 cases, more than triple the number from last week. Maryland and the city of Los Angeles seeing their first cases this week after residents who traveled overseas became infected and returned through Dulles and LAX airports. The super contagious virus now confirmed in at least 15 states, spreading easily through the air when an infected person talks, coughs, or sneezes, remaining in the air and on surfaces for hours.
Measles can have some really, really serious long-term consequences. It can cause encephalitis, which is basically an infection in your brain that causes brain swelling and can cause permanent brain damage.
While the CDC says the measles vaccine is the best defense, doctors worry some families are turning to alternative treatments like cod liver oil and other supplements rich in vitamin A.
They want something other than a vaccine to be able to protect their children. And at this point in time, we don't have those alternative treatments.
While Health and Human Services Secretary Robert F. Kennedy Jr. says the vaccine does protect children against measles, he also touts vitamin A as an effective therapy. Writing in an op-ed last week, vitamin A can dramatically reduce measles mortality.
What is the cure for measles? Cure for measles is chicken soup and vitamin A.
While the CDC says vitamin A may be used to treat measles under strict doctor supervision, the American Academy of Pediatrics says it doesn't prevent measles and can be harmful to children in large or prolonged doses.
The best treatment that we know that has been proven for decades is vaccination. And that is probably the biggest message that needs to come out of this outbreak.
Now, experts say if you don't know your vaccination status, here is a quick lesson. Anyone born before 1957 is likely immune from previous infection. From 1957 to 68, the vaccine was not as effective, and you should get a booster. From 68 to 1989, the guidance was only one shot, so you should probably get a second shot, too. It can't hurt you. But, of course, anyone who is immunocompromised or pregnant should consult their doctor first. Savannah.
Good reminder, Liz. Thank you very much.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.